we, in the musculoskeletal situation, sometimes don't have the normal quality of life thereafter, do we? If that makes sense.
Yeah, and I think, I mean, there's a lot to consider. It's not just like you said about the success rate or not of the procedure, although usually you find that the conversation is centered around that. Actually, from the animal's point of view, that's an acute situation. So yes, it's not very nice for them to go through, but it's relatively short term. You also need to consider the long-term impact. How many times are they going to have to come back to the vet surgery? What's their personality type? So is that a really stressful event for them, or are they quite comfortable in that environment? Are they going to have repeat blood tests? Are they going to have treatments that they don't particularly like, maybe injections or tablets, and they don't like taking tablets? Maybe they do, and so that bit would be easy, but these are all things that need to be considered. So the burden of the treatment afterwards needs to be considered, as well as the initial burden of the surgery. And then, like you said, the ultimate outcome. I mean, in human patients, the reviews that have been done in the literature show that between 2 and 10% of surgical patients suffer severe chronic pain.
That's so crazy.
Now, we have no idea what percentage of our veterinary patients suffer severe chronic pain, because we just simply don't look for it. But we know that there are some patients that obviously show severe chronic pain after surgery, but we have no easy way of evaluating it because we can't ask them. But to know that 2 to 10% of human patients that undergo surgery have severe chronic pain means that it has to be something that should be incorporated into our decision making. And we know already from research in animals and humans that animals that already have a painful condition are more likely to suffer severe chronic pain. Animals that have high anxiety are more likely to suffer severe chronic pain. So some of these other things around looking at the patient as a whole, I think, are really important when you're deciding about whether to go ahead